We're live. This is why I don't want to flip anybody off or anything. This is why we're late today. I had a little issue with a finger lesion today, so I had to bleed everywhere and do what I needed to do. Thanks. Do what I needed to do. Thanks. And take care of this finger to ensure that I didn't die, right? When we were little, we used to always say that if you had a cut, that your guts were going to come out and through the hole. And sometimes I still remember that. Good afternoon, April Lopez, coming to you live today from Lopez Family and Wound Healing Clinic. I am a very proud family nurse practitioner. I am also a board-certified wound specialist and a board-certified skin specialist, and I'm also an adult geriatric acute care nurse practitioner. Each of those is a separate board certification. That's why I have to share with you all of them. One, because I'm very proud because we worked very hard. I was talking to my friend today, and he just finished paying off his student loans. So I'm very proud of him. Shout out to him. Love you. And I said, you know what? Those student loans are such an accomplishment. One, to have acquired them, and two, to have paid them off. I was kind of happy when they were on deferment, but I am a person that is quite responsible for what she does, and I like to pay my bills. So I can tell you that if you paid off your student loans, it's quite an accomplishment. I just paid off my last $50,000 this year because I keep getting masters, and I will be going back to law school for fun. I'm going back to school for law because I feel like there's a lot of need for advocacy, and there's very few pro bono attorneys or attorneys that do any advocacy or any pro bono cases at all. We're all trying to make a living. I know that, guys. And I'm well versed in business. I help people open businesses. I do a lot of business consulting and wound care consulting. So I am well versed in the fact that we all need to pay our bills. And then, of course, this is the United States of America. Praise God. I believe in a capitalist society. And in this country, if you work hard, go to school, get a good trade job, open a business, and do what's right, you can be very successful. Only in the land of the free. I love this country. So I am well versed in that, guys. But I also feel like there's a lot of need for advocacy. One of the things that we're going to be talking about today is just that, advocacy. And if you follow our page, you see that I am a very passionate advocate for people in general. I am first and foremost a nurse, and we talked about the fact that nurses are, in the Gallup polls, continue to be the world's most trusted profession. And I believe that that is because we hold your lives in our hands. But as nurses, we have to be advocates throughout the world, throughout our lives, throughout our areas that we touch, the people we touch. It's lovely. I have friends that do, and we're going to be having interviews. Yes, we're going to have interviews. If I could just coordinate my days to get them in here. They're all available. I need to get them in here and have them sit on the chair. So you'll be seeing some people sitting on the chair. But I have friends that do a lot of medical missions, and it's an amazing thing to do, to build houses and hospitals and clinics in other countries. It's amazing. But I am an advocate where I am. I am an advocate where I go. I am an advocate in the booster clubs that I'm a member of. I am an advocate in the boards that I sit at. I am an advocate in the nonprofits that I help run. I am an advocate in the schools, in the hospitals when I round. I'm an advocate here in the clinic when I see abused women that need to be reported to Adult Protective Services or Child Protective Services. I advocate for those people. It takes a lot more work. It takes a lot more time. And if I just see her and say, nah, she's fine. That man actually didn't drag her through the streets, and that's why she has all those wounds. No, that man actually did drag her through the streets. That man actually potentially, allegedly, this is not legal advice, this is not medical advice, allegedly dragged her because she's full of gravel and she's scared of him and he's laughing. You know, I always be leery of a gentleman that laughs a lot in the middle of abuse, in the face of abusing women and men. Abuse is the topic we're going to be talking about today, and I'm going to do again my 15 minutes in English and my 15 minutes in Spanish. And one thing that we often wonder, and I personally as a victim of multiple types of abuse throughout my life, some that I have disclosed and some that I have not, but certainly as a recovering emotionally abused woman, I can tell you that It is something that is very widely accepted throughout society. It is very widely accepted in the medical field that women and men, not just women, are abused. A lot of times people in leadership are abusive. A lot of times people with certain degrees are abusive. And a lot of times, most people want to stay quiet about it for so many reasons. Right now, we're dealing with, I've dealt with this before. I've talked about this before. I have reported this before. I will report it every single time. I think that the main reason why people don't report is fear. Fear of the abuser. I just recently found a group that is a very objective group, and I really like it. And it talks about how after you're abused, a lot of times these abusers will ostracize you. They will make you an outcast in society because most of the times abusers are not okay in their mind. They're clearly not kind, and they clearly are not happy with who they are. Most of the times they have some sort of low self-esteem issue, and they're taking it out on the person they're abusing or the people they're abusing. A lot of these times these people are very charismatic and everybody loves them because one, a lot of times they're good looking. A lot of times they're very friendly. They smile a lot. They know just what to say to get people on their side, you know. They give you inspirational quotes and they want you to believe and they want you to join their cause. And then once you do, the abuse comes, and it comes in a lot of different ways. And as always, I have provided you with some research studies from multiple renowned sources. This one happens to come from the Journal of Child and Adolescent Trauma, and specifically emotional abuse clearly can happen at any age. You don't have to be a teenager, but sadly it usually happens to the underserved, and usually the younger population are underserved. A lot of times in the school setting, the teachers are at an advantage clearly because they are in a leadership position and they are the powerful being, right? The powerful person in the relationship. So a lot of times it happens in the schools. So the question we have here today, but it can also happen at any age. So all of this can be applied to any age. The question we have here today is, thanks for everyone saying hi. Hi guys. Michael, stop calling me. I'm in a live. Okay. Husband, can you call Michael? He needs you. I love these live things. But the question we have here today, is emotional abuse as harmful as physical or sexual abuse? What do you think, guys? Those of you that are on there, what do you think? Is it? Absolutely it is. You know, I have personally sat down with many abusers, lots of mixed, personalities. With all of the studies I have, I quickly identify psychiatric and psychological issues. And I always tell people, having an underlying psychiatric or neurodivergence does not give you a ticket to be mean, belligerent, manipulative, to ostracize, or to abuse anyone. Not your wife in forms of cheating and then blaming it on her, or your husband in forms of that, not your children in forms of blaming them for everything that's going wrong, and certainly not people that you are over leadership positions over, that you're supposed to be guiding and treating with respect and with kindness. Now, mind you, I always tell people, they ask, well, should we have a conference? It's very difficult for me to sit down and try to have a behavior modification conference with a 50-year-old person because you've already been shaped. And at this point, with or without an actual psychiatric or psychological diagnosis, you are choosing a lot of these things. You are choosing to do them because one, maybe it's a pattern, or two, maybe you enjoy it. Okay. And so there's a very fine line between just not being kind and having a psychiatric issue. Nonetheless, psychology and therapy and medications can help if these people want to get help. So it's very important that we understand that emotional abuse is clearly just as harmful as physical and sexual abuse. And if you look at the link that we have provided for the actual research study, you can see that some of the key words are early childhood trauma, emotional abuse, consequences of trauma, and what are the treatment. First of all, I want to say, young lady, young man, young teenager, that you feel unheard, that you feel unseen, that you feel like if you speak up, something bad's going to happen. Don't feel that way. We are advocates. We are advocates in the community for patients, for the underserved, for the weak, for the widow, for the sick, for the child that is maybe not here with legal status, the mom that can't speak the language, that feels like the teacher is ostracizing or targeting the student, or the patient that feels like the doctor was mean and belligerent at the clinic, at the visit, that the doctor was aggressive with the wound care because they sought a second opinion and they were a little rough on the wound. And let me tell you, all of that can be reported, and it should be reported. And that's why, part of the reason why I'm going to law school, because I have to provide this legal help free for these people. Why? Because somebody has to be a voice for those people. Nurses, people in the medical field, if you see abuse of patients, if you see practitioners trying to do procedures on patients that, one, the patient does not understand, and two, they did not agree to, or they have questions on, stop it, stop the procedure, call the practitioner that wants to do it. They're the ones that are supposed to give informed consent. Students, if you feel like there's a teacher that is being inappropriate with another student. Now, teachers, I want to remind you, and anybody in leadership, anybody in a leadership position, there is a personal space that should never be crossed between you and the students. You are not to put your hands on students. You are not to kiss students. You are not to hold students. If you see young men or young women crying, you can send them to the counselor's office, be there for them in a professional way. It is very condescending when a woman is crying or a young man is crying for you to go and hug. That is not what a person in leadership position does. Bosses, doctors, it is not for you to hold the nurses. It is not for you to hold even the patients. We don't touch people. This is personal space. There's so many things that can go wrong when you do that. So if you're doing that, don't. If you're doing it, you will be reported. Young ladies, report it. If anybody makes you feel uncomfortable, young men, if anybody makes you feel uncomfortable, if somebody is making you feel unwelcomed in a setting where you're forced to be, if somebody is making you feel like, wait, was that appropriate? Did that actually happen? Guess what? It probably was not appropriate. If you ask a little 5-year-old, hey, is this right? And no, they already know right from wrong. Don't trust your gut as a parent. If you feel like somebody is acting, unusual around a certain person, your child's acting unusual, an adult is acting unusual around your children, let's have these conversations. This is why we have so many broken people, because everybody looks the other way, doesn't want to talk about it, doesn't want to offend anybody. And guess what? Emotional abuse is just as harmful as physical and sexual abuse. And if you do not report it, then it becomes sexual abuse. Is it sexual abuse if somebody holds you in an unwanted sexual way? Yes, absolutely, that is sexual abuse. And we have to report it. The Children's Bureau reports that nearly 3 million U.S. children experience some form of maltreatment annually, predominantly by a parent, caregiver, family member, or somebody in leadership. That is 3 million. How many of these 3 million do you think are actually going to report the abuse? According to the American Psychiatric Association, trauma specifically is described as perceived experience that threatens injury, death, physical integrity, and causes feelings of fear, terror, and helplessness. Let me read that again. The American Psychiatric Association describes trauma as a perceived experience. If they perceive it, it's valid. If they perceive it, it's real. It doesn't matter if it's not real to you as the person in leadership. It doesn't matter if it's not real to you as the boss, the doctor in charge, the person in charge, the teacher in charge, or even the coach in charge. What it matters is that the student had a perceived experience that threatens them with either injury, death, or physical integrity, and causes feelings of fear, terror, and helplessness. Let's talk about that for a minute. Is physical integrity considered when you are having an anxiety attack? Absolutely. Those of us that have anxiety can vouch for the fact that it causes tachycardia, fast heart rate, palpitation, shortness of breath, lack of focus, cold sweats. I have had to leave social situations because I'm having a full-blown panic attack from my social anxiety. It is a very real mental issues with that is a very real physical response. You are not feeling safe. That's why we get therapy. Emotional abuse. specifically relationships in regards to those who report emotional abuse, psychological maltreatment, emotional abuse, neglect. Let's talk about neglect. Neglect is when you just ignore people. When they have concerns, you're in a position where you're supposed to be taking care of them. Babies are neglected a lot. Wives, husbands are neglected. When you're in a relationship, in a setting, teachers, bosses, doctors to nurses, where you're supposed to have a working relationship or a school relationship or a business relationship, and what's happening to you is you're being ignored. You're asking for something, you're asking questions, you're being ignored. You're speaking, you completely are ignored. And what is that? In what normal world, in what normal mind frame, kind leader, nurturing setting are people ignored? Ignoring people is the greatest form of emotional and psychological abuse, because they say, oh, did I do something? Did I say something? They have all these thoughts. And those are the people that haven't had enough therapy to understand, wait a minute, this person is toxic. This gentleman is not well. This person is abusing me by ignoring me. I'm not doing anything wrong. I'm trying to get feedback, and I'm forced to be in this situation right now because I have to be in a relationship with them, whether you're working on a club or in a team or in a job, and this person is abusing me. That is psychological abuse. There's a lot of personality issues that I'm not going to go into, all of the confusion that happens when people have personality issues. Your personality issues are your own. That needs to stay outside of work, outside of school, outside of a setting where you're a leader. At those places, you have to put on your best foot forward. You have to be kind, you have to be appropriate, and you cannot go around emotionally abusing people. Depression and anxiety, we already have talked about that before, and we're going to continue to talk about that. So what are the takeaways? What are the takeaways from the study? Discussion. A study focused on examining the negative long-term consequences and risk factors for adults, and specifically from those adults who suffered early childhood trauma as a teen, as a child, particularly focusing on the trauma of emotional abuse. As predicted, those who reported emotional abuse, perceived is valid, have a higher percentage of depression, anxiety, stress, and neuroticism personality. It is not hard to understand that, as stated in the literature, emotional abuse has been theorized to cause adverse development consequences equivalent to or more severe than, attention, take some notes, those of other forms of abuse. This is why I am so aggressive in defending those that are being emotionally abused, because it is such a subtle thing. And you're doing it with a smile on your face. Most abusers do it with a smile on the face, and they're here to support, and they are emotionally abusing those people. And when those people report, they are ostracized and treated as outcasts and as crazy people. Don't be the one that's known by that. Don't be that person that does it. If you are going through that, reach out, send us a text. We'll put you in contact with the right people. If you are a parent that feels like this is happening to you, there's chains of command to report at different ISDs. We have helped different people from different school districts file the proper complaints. And guess what? People listen. People listen. We are still blessed to be in a country where we have checks and balances, and people listen. So if you are a victim of emotional abuse, understand that it is just as real as a slap, as a hit, as a kick. It is just as important to address it, or more so than if somebody was beating somebody up. Why? Because clearly research shows that it is just as detrimental, not only in child development, but in the overall psychological outcomes and well-being of these people, or more so than physical abuse. Let's focus on those subtleties, emotional abuse. Let's report it. Now we're going to switch over to Spanish. Familia, Abril Lopez, enfermera de Práctica Avanzada. Estoy platicando con ustedes hoy tocante al abuso emocional. Al abuso emocional, estamos viendo, familia, si el abuso emocional en realidad es igual de dañino que el abuso físico. Estamos específicamente hoy enfocándonos en las edades de niños adolescentes. Estamos viendo las investigaciones clínicas tocante a si en verdad ¿existe abuso emocional? ¿O es algo que nos estamos inventando cuando estamos un poquito neuróticos o neuróticas? Cuando hablamos de gente tóxica, a veces la gente lo usa como un chiste, pero la triste realidad es que la mayoría de nosotros conocemos a gente muy tóxica, con muy poco balance emocional y mental. Y lo difícil de este tipo de cosas, familia, es que en estas situaciones muchas veces las personas que están enfermas, que están haciendo un daño, y cuando hablamos de enfermedad psiquiátrica y psicológica es algo muy real. Estamos hablando de que sí existen esas enfermedades, pero a lo que yo voy es, si tú eres una persona que tiene una enfermedad psiquiátrica o psicológica, o si eres una persona que piensas que ser abusivo, abusiva, es correcto, ya sea en un lugar de que eres un maestro, que estás en una escuela, ahorita, ya sea que eres un doctor, que piensa que maltratar a sus asistentes clínicos, asistentes médicos en la oficina es correcto. Puede ser que seas un entrenador físico, que piensas que es correcto abusar o maltratar. Acabamos de ver. ¿Quién no vio la nueva noticia que salió del entrenador físico que estaba abusando a un joven y lo puso a hacer ejercicios sin ropa? Eso acaba de pasar aquí en el Valle. Un entrenador físico puso a un niño a hacer ejercicios sin ropa. ¿Dónde estuvo el padre, la madre, no de ese niño, pobre niño, de los niños anteriores cuando este entrenador físico mostró señales de abuso mental y emocional? ¿A poco piensan ustedes que este profesor, ese entrenador, no estaba demostrando ciertos comportamientos inapropiados hacia los niños o las niñas? ¿A poco piensan ustedes que a lo mejor no fue un poco grosero, un poco ignorar a los niños, un poco prepotente? Este señor, ya cuando tú llegas a un punto que estás poniendo a niños a hacer ejercicio sin ropa, entonces tú ya tienes un patrón de abuso ya crónico que ya viene de abolengo, ya viene de muchos años, ¿ok? ¿Y qué pasó? Alguien no lo reportó. Claramente mucha gente no lo reportó. Lo que nosotros estamos ahorita, lo que estamos educando a la familia, a la comunidad, es específicamente que cuando ustedes estén viendo un patrón de abuso emocional, porque estoy en el live, los resultados demuestran que el abuso emocional es igual de dañino, sino más dañino que un abuso físico. Cuando una persona está abusando a un adolescente, a un niño emocionalmente, eso previene que el niño se desarrolle, la niña se desarrolle normalmente. Su cerebro está bajo estrés, está con ansiedad, está con pánico a llegar al lugar donde está aquella persona que es el abusador. Y el abusador emocional es algo mucho más difícil para probarse que un abusador que te cachetea, que te muerde, que te patea, que te avienta algo. Eso es muy fácil identificarlo. Vamos a estar tomando conciencia y vamos a estar vigilando y viendo a las personas que están en un lugar de liderazgo, a los maestros, a los entrenadores físicos, a los doctores encargados de clínicas, enfermeros de práctica avanzada, a los jefes que están encargados de unas jovencitas, a lo mejor que las jovencitas son vulnerables, las jovencitas están viendo a este jefe que es hombre con ojos de respeto, con ojos de admiración, y ahí es donde cuando empiezan a manipular a las jovencitas, que empiezan a abrazarlas o empiezan ay, llora la niña, la agarras y le das un beso en la frente. Señores, maestros, señoras, le pasa a los niños también, que estas maestras piensan, o estas personas en liderazgo, las jefas, piensan que pueden agarrar a sus niños, a sus chamaquitos de menores de edades, y los andan agarrando y los empiezan a abrazar. Y no, señor. Una persona en liderazgo necesita mantener su distancia profesional. No podemos invadir el espacio personal de las niñas. Si eres entrenador físico, no se tocan, no se besan, no te les arrimas. No es correcto. Si eres jefa y un jovencito, si eres una persona encargada de un negocio o X o Y un jovencito llega y, ay, ¿cómo estás? Y lo agarras, no, señor, eso es incorrecto. Familia, si estamos identificando un patrón de abuso emocional, esto es abuso emocional, el joven, la jovencita, el niño se siente incómodo, esto me hace sentir incómodo, pero ¿soy yo la que está mal? ¿Soy yo el que me estoy imaginando? No quiero decir nada porque necesito el trabajo, híjole, no quiero decir nada porque no quiero que se enoje el entrenador físico, no me vaya a dejar de dejar jugar. No quiero que mamá se moleste conmigo, no quiero que papá se moleste conmigo. ¿Quién va a hablar por ese niño, por esa niña? Estamos hablando por ese niño, por esa niña hoy. Estamos hablando por los padres que sienten que no pueden decir porque están en una situación incómoda y no quieren problemas. No todos los padres tienen voz. Estas pláticas que estamos dando es voz. Quiero darle voz, quiero darle información, quiero darle herramientas, quiero darle investigación clínica. Este es en español. ¿Cuáles son las palabras claves de este estudio clínico? Intervención. Si no intervenimos, ¿quién va a intervenir? Si no somos nosotros los que reportamos a ese maestro, a ese jefe, a los superiores de esa persona, a ese doctor que maltrató al paciente, ¿quién va a ser? A esa enfermera que maltrató al paciente. Hay que intervenir. Toma un poquito de tiempo, pero vale la pena. Y hay un Dios que todo lo ve. Hay un Dios que todo lo ve. Prevención. Esperemos que esta plática ayude de prevención para que estemos más conscientes de decir, oye, ¿cómo está mi niño? Hija, ¿cómo te ha ido en la escuela? ¿Cómo te está yendo con tus entrenadores? ¿Te están tratando bien? Acuérdate que nadie te agarra, nadie te toca. ¿Te están respetando? ¿Están tratando bien a los otros niños? Porque a lo mejor a su niño le va bien, pero a los otros niños les va de la patada. A su esposo, a su esposa, ¿cómo estamos? Una de las formas mayores y más útiles de abusar a una persona emocionalmente es ignorándola. Ignorándola. Eso es un problema mayor porque no te dice nada. Nada más, ¿qué? No te dice nada. Pero, mi amor, ¿no me estás hablando? No tengo nada. Y estamos con las jetas maltratando a la persona. Y si tú eres la persona que está haciendo eso, concientízate. Obtén algo de terapia. Si somos los padres, familia, que nos enojamos y ya ignoramos al niño todo el día, el niño lo resiente, eso afecta. Yo soy una madre dura. Soy una madre que les dice a sus hijos, mira mi niña, tu madre trabaja, no te estoy dando solo frijoles, te doy carne. Entonces, tienes que ser agradecido, no seas grosero, no seas igualado. No estamos hablando de no educar a los niños. Estamos hablando de tener algo de conciencia tocante a su estado mental y emocional y entender que hay formas de tener un maltrato infantil si no estamos conscientes de que el abuso emocional existe. No estamos locas, no estamos histéricas, histéricos, no estamos inventando y tenemos que compartir esta plática, platicar, tener esas pláticas difíciles. Decir, híjole, hija, el maestro te maltrató, híjole, vamos a tener que ir a reportar. ¿Por qué razón a lo mejor el niño no quiere ir a la escuela, no quiere ir a esa clase? Oiga, ¿no se les hace algo interesante? ¿Por qué no quiere ir el niño específicamente a esa clase? Y luego los maestros, como están encargados, o los jefes, ay, ella está loca, no, los reportan. No, hay que tener conciencia, hay que estar visualizando. ¿Cuáles son los resúmenes clínicos? Esto es clínico. Si ustedes ven los links que les pusimos para que ingresaran, esto está basado en ciencia. En definitiva, los y las profesionales de APS pueden desempeñar una función clave en la detección del abuso emocional. ¿Qué es lo que podemos hacer? El seguimiento y medio a largo plazo de las situaciones del maltrato. ¿Qué necesitamos? Crear un espacio seguro y apoyo integral. Reconocer los signos y los síntomas asociados con el maltrato emocional en la infancia y en la adolescencia. Explorar de manera sensibles esos signos y síntomas, sin ofender, sin juzgar. Algo muy importante, si hay una percepción de abuso, una percepción de incomodidad, hacia el niño. Si el niño lo percibe así, es válido, hay que ayudarle. Servir de enlace y creación de red con otros servicios. Yo tengo muchos conocidos en diferentes partes, obviamente consultamos con abogados cuando hay casos especiales, consultamos con los servicios de los servicios protectores de salud de niños, servicios protectores de salud de la tercera edad y de adultos, y consultamos con todos los servicios. Gracias a Dios que estamos en los Estados Unidos, no nos tenemos que quedar callados cuando estamos viendo abuso. No debemos dejar que haya abuso emocional en ningún nivel para nadie, ni para niños, ni para enfermeros, ni para pacientes, ni para mujeres, ni para hombres, ni para nadie. Les agradecemos mucho. Este es un tema un poco difícil, un poco pesado. Se ofende mucha gente, pero yo estoy aquí hablando por aquel que no tiene voz, por el paciente abusado, el niño, la niña abusada, y quiero que sepan que hay apoyo. Si tienen alguna pregunta, algún caso, mándenos. Nada de esto es ayuda legal, es ayuda emocional, social, y podemos ponerlos en contacto con gente que puede ayudar. Esperemos que esto le ayude y nos vemos la próxima semana.